I'm sure it's a struggle every day, especially with COVID for the last year and a half.
Who do you go to? How do you pay for it?
People are afraid to even speak how they feel because they're so afraid they're going to get ridiculed for it.
If there has been a stigma in the past, it's starting to break down.
If you're really struggling, I think you should first tell someone you love, and then, they will definitely help you and put you in the right direction.
It's okay to not be okay.
Seeking the help of a mental health professional can be a daunting task. During the shifting sands of a pandemic, mental health has been a concern for many in our community. Welcome to this Focus 15 special, Mental Health and Hope. I'm Dirk Rowley.
And I'm Alyssa Ivinson. Tonight with our partners from the Bowen Center, we hope to strengthen and serve our community with more information about their mental health care. What are the options? What's the first step? How do you handle tough conversations? We hope to give you guidance and connect you with the answers you need.
This is a Focus 15 special, Mental Health and Hope. Now, here's your hosts, Wayne 15's Alyssa Ivinson and Dirk Rowley.
And again, we want to thank you for joining us this evening. Let's meet our panel. Dr. Jerry Greer is the medical director of Bowen Health Clinic. Dr. Sequila Liebetrau is the clinical director at the Bowen Center. And we also have a third guest, Alyssa.
That's right. Connect Allen County's Kylie Ricken. Thank you all so much for joining us tonight for this discussion. Let's start with an overall bird's eye view, if you will, of just where are we in the state of our mental health in our community right now. Dr. Liebetrau, we'll start with you.
Yes, people are struggling. We're definitely seeing increases in anxiety, in depression, in substance use, and children are struggling too. And I think it's really tough on children because, especially the younger ones, they don't always have the words quite yet to explain what's going on. And so they may also not have the coping skills built up that adults have. And so there's a variety of things going on. And I think it really also depends on where you're at going into the pandemic. Some people had pre-existing mental health conditions and other struggles. And there are so many things that are compounding things right now, right? So if you lost your job as a result of the pandemic, or you have a decrease in your income, or for the children, if you've gone back and forth with quarantines with in-school e-learning, and their world is just so big, right? So whenever we shift their world around, that can make a really big impact on mental health.
Mm-hmm. Any of the others want to join in on that first question? Just where are we right now?
I think we're on the upswing of things with some of the restrictions that are being taken away now. But I know in the beginning, there was so much isolation that was involved. I did some prior work at a nursing facility, and that was very difficult because a lot of these patients had depression or mental illness, and then they didn't understand why people weren't coming to visit them, family and friends, because they couldn't, to protect them for their health. So that was a big struggle. But as things have gotten better, restrictions have been lessened, the isolation has been decreased significantly. But I still think it's affecting a lot of people long term because that has weighed heavily on their mental and physical health from that standpoint. That period of time we had for the last year and a half, 2 years has been a struggle for all of us, even people who don't have mental illness. It was definitely a stress for us all. Mm-hmm.
And a lot of those stressors, like you were mentioning, if you lost a job and maybe you're not sure where your next paycheck is coming from, that can be helped with some resources available. And I know Connect Allen County has a lot of those opportunities, right? Can you kind of explain what that Connect Allen County is, Kylie?
Yeah, so Connect Allen County is a no wrong door community resource access center where anybody in our community can go to get access to the services and supports that they might need for themselves or for their families. So we can connect people to things like mental health counseling, housing, food, any kind of family supports, and even health care with all of the different providers in the building.
So when I walk into the grocery store and there's not stuff on the shelves, it makes me, I want to say, anxious. Mm-hmm. I don't believe that's necessarily rises to the level of seeking care, but how do I know the difference between when I need to call you and when it's just one of those passing feelings like, oh, things are still unsettled and that makes me uncomfortable?
Everyone really needs to, excuse me, look at their own baseline. And by that I mean, how do you normally function? So if you notice that, gosh, you just can't keep it together at work anymore, or school is suddenly just not working the way it did before. So looking at the way you function in your world, and are you still able to do that, or are you noticing patterns where you're just not able to function the way you did before? That is a really big sign, I think, to start with.
Is it difficult, though, sometimes to recognize that, or maybe a loved one recognizes that in you, but they're not sure how to talk about it? So how do you start those tough conversations if you have a family or a friend who you can see struggling, you can think they would benefit from some of this help, but you don't want to push them away, you don't want to upset them? How do you start that conversation?
I think it's something that you go to present yourself to somebody, you got to do it first in love, but say, you know, I see that you're struggling in this area, and is there anything I can help you with, or is there things that in your day-to-day life or your schedule, or things you think you need some support with? So you're kind of presenting it as you're offering support, not kind of putting them down or saying you've been really irritable and difficult to deal with lately. You're saying, I can tell that you're having some struggles, and put it back on them to say, hey, do you think there's some things we can help you with to work on? And the point you made earlier is very, very important, because a lot of times people will not recognize the changes they're going through. I will have spouses, significant others say, something's changed, and the patient doesn't even realize it. Or even if they've gotten put on medicine, they'll say, I don't think it's doing anything, and everybody in the family says, yes, it's helping, please continue the medicine. So that input from everybody else is just as important, but the person needs to realize that there is a problem, and then go forward from there.
One of the techniques we've learned in dealing with people that you may have suicidal thoughts is the QPR, the question, persuade, and then refer. Sometimes, though, people, I think, just are so stuck on, oh, this could be a really, I don't want to ask a question because that may put ideas into their heads. That's not really what medical professionals think, right?
Well, we know that's not what happens. If somebody has suicidal thoughts, you're not going to trigger it by asking them. In fact, I think for most people it's a relief when you are showing up and saying, hey, I'm here to listen. I'm here to ask questions, and I'm here to help and support you in any way you need that support. That helps people to open up and feel safe to talk, and feel like they can take the next step to get additional help if help is needed.
So what is that next step? Where is that help available, and how does somebody find it?
Gosh, there's so much help out there, and we have so much more access now than we ever did before. There's therapy available either in an office setting, or you can do telehealth, where you do therapy via a video link or a phone link. So if you are somebody that struggles with going to an office, whether it is maybe transportation is a barrier for you, or maybe your work schedule is too tight, or maybe you don't want to go into a big office with a lot of people because you're still nervous about your health, then you can definitely do teletherapy. And I think the same thing certainly can be said about medication management. There's so much more access now than there ever has been before, and it's for adults and children. There are so many more professionals out there that are equipped to provide that support. And so I think I would just say to people, just reach out. Just take a look and see what's available out there, because there are many options.
Linda is one of the viewers that submitted a question, and she kind of touched on this whole question about why is it so difficult to get care in the moment when you really feel trapped and need someone. Kylie, you said there's no wrong door to your organization. Does that mean if I need help right away, you can offer it?
Yeah, so there really are so many resources, but it is hard to navigate which resources are available for me and what do I qualify for and where do I start with. So we have a no wrong door policy that no matter what your need is, if you come to connect, we're going to be able to connect you with whatever services and supports that you need. So the important part is really just reaching out. We have navigators that will sit down with an individual or family and listen to their story and find out what their needs are, and then help them narrow down what is available to them, what is going to be best for them based on their own needs, so that we can get them connected to the correct services.
And Dr. Greer, one of the things that you do at the Bowen Center is you treat the mental and the physical together. Can you explain how those coincide and why that's so important to treat them at the same time?
Well, we know that the physical affects the mental and vice versa. So if someone has depression and they're not treating it, their physical health suffers just as well as vice versa. So the patient, oftentimes, if they're not taking care of their depression, they're also not neglecting their diabetes or hypertension, and they're depressed and feel bad about themselves, or they just feel bad or not motivated to do anything, so they don't do anything, which obviously isn't helpful. So when we see them, we try to get them on medicine to not only just treat their depression or their mental illness they're dealing with, but also, hey, now let's make sure you also focus on your hypertension or diabetes, because those can be life-saving just as well. We know that people who don't get mental health services don't live as long as people who do. We know that that can affect your life expectancy. So by doing those things, taking care of the mental and the physical health, we can increase somebody's life expectancy. And it's something as simple as doing screening tests, monitoring blood pressure, blood sugar, things that we can do in the office and improve their overall health. And I think one of the big things that I've worked in different organizations, but the stigma that you can see with depression, people don't want to talk about it. And we try to have a very open environment and try not to have any stigma associated with that, because we have so many mental health professionals, counselors that we deal with on a day-to-day basis. These patients are coming back and forth between us, and they know that we're not going to look down upon them because they're dealing with bipolar disorder or schizophrenia. It's like it's another medical condition that's being treated, and it's not going to stop us from taking care of your hypertension, diabetes, or anything else.
Do most people who see success with treatment, are they more open? Are they more willing to share with their family? Or does it matter if they try to keep their treatment private? Do you see a difference in how people, I guess, how public they are, or how personal they keep things? Is there a difference?
I just think it's very personal, right? Some people heal through sharing the road that they've traveled and the struggles that they've had and how they've overcome those struggles. And other people just feel like, it's my business. You don't need to know. I'm not going to tell anybody. And so it's just very unique. And I think there's opportunity for both. If it helps you get better and it helps you heal, do what you need to do. We'll be here to help that process and to walk alongside you, but you have to do what's best for you.
At the very beginning of the show, we heard from several people in the community, and when we spoke to them about mental health, some people said, well, there's the stigma, and people don't want to come forward. They don't want to say, I'm not okay. And then someone else said, well, I think the stigma is starting to go away. Where do you feel we are in that stigma now, and how do we help it go away?
There still is stigma. It's better. I think the younger generations are growing up hearing that it's okay, and they feel more comfortable to talk about their mental health or their mental health needs. And at the same time, it's still there and it's very real. So I think what I always like to say to people is, if you need help with your taxes, you go get help with your taxes. If your child needs help with math, you get them a tutor. This is exactly the same thing. If you need help with your emotional well-being, get help. Nobody else needs to know. You can have a private conversation with your prescriber or your therapist. You can tell them what your needs are, and they can build a beautiful plan to help you get better. And the person is a trained professional. They're objective. Because when you ask your mom or your best friend, they're going to tell you what they think you should do, versus your mental health professional is going to really give you professional help and shape a plan that really works best for you, not for the other people in your life, that works best for you.
All right, we want to put a pause on this right there and say that we are going to come back. We want to discuss questions that you may have about financing. Like, this all sounds great, but maybe I don't have insurance or I don't think I can afford help. We want to tackle that question on the way here next.
Focus 15, Mental Health and Hope, is brought to you by the Bowen Center. Introducing the newly redesigned Wayne.com, featuring a new modern design. With quick access to all the news and weather that's important to you. Breaking news as it happens. More live streaming video. Local weather and your 10-day forecast. A better experience to make it easier for you. Visit the newly redesigned Wayne.com today.
This is home. As our world changes, you need answers. Because when this is home, everything matters. We care more about our schools, our safety, and staying connected. Because we don't just live here. This is home. By asking the right questions, the tough questions, you get the answers you need to help make more informed decisions. This is your home. This is your life. And Wayne 15 is here to help you make the most of it. That's local coverage you can count on.
Now back to Focus 15, Mental Health and Hope, with your hosts Alyssa Ivinson and Dirk Rowley.
Welcome back, and we are talking about how to access care if you are experiencing issues with mental health, how to get that help and that hope here in our community.
Dr. Greer, let me go back to this question of not only care, but how to pay for it. What's the Bowen Center, what do most folks do as far as people who present themselves and may say, I don't have the ability to pay?
We don't let money be a barrier to access to care. So if a patient doesn't have insurance, we still see them, and we have measures in place to try to help them go through the steps to try to apply for insurance if they can get it and see if that's a possibility. But we don't let that be a barrier to their access to get medical attention at all.
Mm-hmm. Yeah. Kylie, how does people getting help and using you to get help through the different resources, how does that help the whole entire community?
Yeah, that's a good question. So everybody needs help, right? Sometimes everybody needs a service or a support or someone to talk to. But when you have a list of needs for your family or for yourself, it can be really, really overwhelming. And so if you don't know where to start, sometimes people don't start. And then things just perpetuate and we start living in crisis mode. So when you have somebody guiding you through the processes, helping you understand what's available, and really walking with you to get enrolled into those services or supports, then you feel empowered. And now you can make better decisions or different decisions than you've made in the past. And it just creates this sense of community where we're all stronger together because we're doing it all together. People feel like they're not alone and there is hope and there is help for them.
It's kind of that dilemma where you need a family doctor and you didn't get a family doctor, months ago when you didn't need one. Do I almost need to know my mental health professional before I need one? Is that a good idea? Kylie, I guess you can.
No, I mean, the best idea is really just to speak up and ask for help. You can come in to connect or call if you don't feel like coming in. And our navigators are really well trained to just really listen and from that conversation and from that sharing, help people figure out what it is that they need and then walk them across the hall or down the hall or upstairs to the clinic to get those services. So you don't necessarily have to know what you're doing or know who you're going to talk to. You just have to reach out to somebody.
And I think that there are a lot of people in situations now who were never in these situations before. The pandemic has changed a lot for a lot of people. And for someone who might be embarrassed that they need some help with housing or they need some help with food, what do you say to them to walk through your door, to start the process?
We try to make it as normal as possible. We share our own struggles with people now and then, and we just try to make it so that this is a normal thing. Like you said earlier, if you have a medical issue, you call the doctor. So if you need a resource, you call someone who can help you. And we just try to talk about it as much as possible. We try to normalize it. We try to help people understand that they're not alone and that this is a whole community that faces these struggles every day.
This question kind of goes back to that idea of going through treatment, and is it personal or is it one of these things I need help with? This question came to us from Floyd, who said, what can be done to change Hipaa law to allow loved ones to know the diagnosis for an adult child or other relatives? Sometimes it feels like people who want to help are on the outside, but maybe that person getting help wants to keep that boundary and keep them on the outside. So maybe it's not a bad thing, but do you find Hipaa gets in the way of people getting help?
I don't know if it gets in the way. I think more it's something that you'd have a conversation with patients about. Like, if you're going to be in treatment, who do you want to be on the inside knowing what's going on with you? Like, is it every family member? Is it a select few family members? Who do you want to have access to know what's going on with your mental health or your physical health? So having that upfront conversation and saying, who would you allow us to share your information with? So I think the biggest barrier we find is that patients don't do that, and then when time comes, we're trying to scramble to get papers signed to say we can speak to this person or that person. If we do it up front and say, these are the people I would like to share this with, then we can be proactive and prevent it from really being a stepping stone. I don't really call it a barrier. It's more of a speed bump. How about that?
Mm-hmm. So but HIPAA does apply to both, physical and mental health information, right? It's
yes,
covers both.
Absolutely. And we realize that it can be really difficult for loved ones, right? They are there, they want to help and support, they want to share maybe information or ask questions of the provider. But we have to step in the shoes of the patient. I wouldn't want somebody to just randomly release my information. That's just not right. But on the flip side also, if you have a conversation as the patient with your loved ones and say, hey, I want you to be part of my treatment team, we can do that. And people that have more supports in their life, that have a larger support system, and that's actually active and involved in their treatment, have way more success. So it can also be a really great positive. We just all have to have the right conversations.
Sticking along the lines of treatment, it can be a very wide range of what treatment looks like, right? It's not always just medication or just talk therapy. There could be combinations, or kind of what does that look like to get treatment?
It's very personalized, which is what I love. It's not prescribed that you have to do X, Y, and Z just like this cookie cutter. You come in and you just kind of share with us what's been going on in your life, what's causing you problems, what's causing you issues with your relationships. And we really just get some background information and more detail about what's going on in your life. And then we can present some options. Obviously, at that point, it's an educated presentation of options based on what you just shared with us, what your needs are. We can say, hey, based on maybe moderate symptoms, I think therapy would be just fine, and maybe I would recommend you come in once a week for a few months. Or I might say, gosh, based on the severity of need, let's talk to a prescriber and include medication as well. And I think one thing about medication that I hear a lot from patients is, gosh, I don't want to be on medication for my entire life. For some people that's needed, but for some people it's not. So it can be something to just help you through a really difficult time, and then when you're ready, and you've built up the skills you need, you can kind of try again with the support of your providers to go without the medication. So it doesn't have to mean that you're on medication for the rest of your life.
Kylie, you've probably heard this said that mental health issues aren't really a casserole disease. If somebody breaks their arm or breaks their leg or has cancer or has a baby, people pitch in and they immediately rush to help. People hear about a mental health diagnosis, and people they're afraid, they're fumbly, it's awkward. What can we do to get over that to help support one another?
Yeah, we call it the non-casserole illness because it's the only illness that you can have that people don't rush casseroles to your door. And I think there are a lot of organizations that are really working hard to reduce the stigma. And I just think that the more we talk about it and the more people share their experiences and with each other, with their family members, providers with each other even, it becomes the norm. It becomes just another thing that we went through that year or that day or that week. And the more we talk about it, there's no longer stigma. I mean, it's going to take time. It's not something that just gets fixed, but it is something that can be normalized by us just sharing and talking to each other.
And I think that when you do share, sometimes your friend says, oh my gosh, I'm thinking and feeling the same way, and I thought I was alone.
Exactly.
And then you can have a conversation over casserole about your feelings.
And sometimes it can be awkward. We say, a lot of our colleagues say, seize the awkward moment. If you feel like something is awkward and something needs to be said or asked of your friend, speak up. Use that time to take that first step, because you could be changing someone's life completely just by allowing them a safe space where they can talk to someone.
How many times at the Bowen Center, because I know you do both the mental and the physical health, do you end up maybe walking down to the medical doctor, or the medical doctor walks down to the mental health counselor? Like, how integrated is it? It feels like it's a pretty new idea.
I think it happens on a daily basis.
Really?
Yeah.
Several times a day.
Yeah,
Yes.
multiple times a day.
Yeah, I would say constantly between Connect and the Bowen Health Clinic, we are up and down with different clients probably 5, 6, 7 times a day. And that's a testament to the providers working together to learn about each other and to know about each other so that we can make a bigger impact on the community and serve people a little bit better. Because if we're recognizing that somebody might have walked in for food or for hygiene items, they might need some health care too. So we just need to listen for the things that they say. And we might say, you know what, if you don't have a doctor, let's walk up to Bowen Health Clinic and see if we can get you enrolled, and vice versa. They will often say, you know what, we've got some additional resources because maybe your health isn't well because you're not eating well, or because you're overly stressed with anxiety or depression, and we can help with both of those things.
I want to go back to children being affected briefly here. Beth asked, how would you be an advocate for mental health classes in school? We just have a few seconds left, but how is that in school for children?
I would absolutely advocate for access to treatment. The Bowen Center partners with many schools, and so we actually provide services in the school. So it's covered by your health insurance, and the school just really provides the platform so you can go class, and then after class you can get pulled out, have a session with your provider, feel much better, and then go back to the classroom and be more academically successful. It's a win-win-win for everybody.
Amazing. Well, thank you guys so much for being with us. You have been watching Focus 15, Mental Health and Hope. Again, we appreciate your time and sharing so much with us and our audience.
We hope this has shed light on resources to help your mental health. And remember, help and hope are both available. Have a great night.